understand there's no public comment, is that right?
Correct.
Okay. I was not at the last minute meeting. I appreciate the other doctor taking over and doing that for me. And I did review the minutes and they looked okay to me. Did anybody have any issues or concerns that we need to correct anything? If not, I'll ask for a motion to approve the minutes.
I make a motion to approve the minutes.
Okay, and second?
I second.
All right, so then all in favor of approving the minutes, any opposed? So we'll approve the minutes. And we can move on to the reports. And who is health inspections?
Okay,
I did see.
yeah, no, I'm here. Okay, so we did 91 inspections, required 19 re-inspections. We also replied to 9 animal complaints. I mean, that's pretty much it, with the exception of what we're trying to do right now within the city is we're trying to crack down on the illegal grills going on within the city. We have a big
Illegal what?
illegal grills where people are cooking outside
Oh, okay.
and selling stuff from their homes. It's becoming a huge problem and we're getting a lot of complaints about it. We're doing what we can with that right now. We're going to put out a media release within the next couple days to tell everybody about enforcement that's going to start taking place in regards to that.
Is the issue that using the grills in of itself is the problem, like it's a fire hazard in certain areas, or is it the fact that they're not just consuming this stuff for their own?
Well, first of all, you cannot cook within 10 foot of a structure with an open flame by the fire code. And second of all, you cannot sell anything out of your home.
Right. I understand the second part, but for example, now let's just pretend, I wouldn't say I'm doing this, but let's just pretend that my grill was on a porch that was only 2 feet from the wall of my house. Is that technically not allowed?
You would have to refer to the fire code for that. As far as a personal issue, as far as a sale issue, it would be no.
Oh yeah, well, that's a whole different story. Right.
Yeah. I mean, we have almost half the bodegas in the city have grills on the sidewalk, and it's becoming a huge.
Oh, I see. Oh, so this isn't just individual homeowners who are doing this. I see. Yeah. Oh, okay. I understand. All right. So you would need a, how would you need a special permit to, I mean, there are restaurants that have grills, but not on sidewalks. Yeah.
Well, no, under our ordinance, you can have a sidewalk cafe outside of your establishment, saying it's a bodega or whatever, but you cannot cook any of the food outside. It has to be cooked from inside. The problem came in where we relaxed everything during COVID. And now we're reeling it back in because it's gotten so out of hand.
Right. Yeah, I get it. All right. Well, that's interesting. I had not heard about that issue. Keep us abreast of that going forward. Good. Anything else on the inspections?
No.
Okay. And how about lead abatement? Let me see, is Jarrell here today, or is anybody talking about the lead abatement today?
Hi, can you hear me?
Oh, there's Jarrell.
Hey there.
Hi, Jarrell.
Good. So so far we have 19 units cleared and completed, and that means that we have done the abatement and the dust wipes were taken and they're under the clearance levels. And then 14 units in different parts of the process. That could be inspections, waiting on the walkthroughs, waiting for materials. It could be a number of different things. In total, 4 radon mitigation systems were installed after elevated levels of radon were detected. So it's only 1 more since our last report, which was 3. So
now the 14 of the lead abatements, were those since your last report, or is that in what time frame was that you did those 14?
This is not additional to the last report. Whatever number I'd given you then, this is I don't know if that's more or less. That's just a cumulative as of right now. There could be some units that were still in progress when last meeting.
Okay,
Does that make sense?
okay. Okay, I had no idea whether the total units that have been remediated might be like 100, and you were just reporting on a subset of those. Okay,
Yeah, total.
all right.
So that's just for our federal grant. We have a state grant that we're already completed. So that's 9 units on that. So
Oh, okay, that's separate.
so that's 19 plus 9, whatever.
Right. Now, does that federal grant end at some point?
Yeah, so the federal grant we have scheduled to end April 2025 with the intention to renew. So our intention is to
Okay, because my question was going to be, when that stops, where will the funds come from if you have ones going forward that need to be remediated? But okay, so all right, great. All right, anything else on the lead abatement?
That's all.
Okay, on EMS, I saw there was some statistics that were circulated for April, which we've looked at. Michael, do you have anything to add to that? Are you on here? I see your mic's off.
Yes, sir. Thank you, Doctor. Pretty much just a couple quick things. We are going to be doing the ride-alongs. I do have the list of people. It's just had some logistical things go on. Didn't get to.
Hold on. Mike, you're really garbly. Can you start over?
Is that a little better?
A little bit.
How about now?
That's better.
We are going to be doing the ride-alongs, and I do have the list of everyone who is interested. Unfortunately, we had a couple logistical things going on, so I will be doing that over the summertime. The only thing that I just wanted to make sure everyone saw with the statistics, I mean, unfortunately, April's were done. We're just getting the information for May now. And as soon as I get that, we will forward that on to everybody. Unfortunately, as we all know, summertime, there's going to be a lot more drug use. It's nice and sunny out, and we've already had a couple of animal bites already happen this year. And unfortunately, as we all see in the news, some violence. The other thing is due to all the issues with EMS, meaning, countywide, if you take notice on the municipalities of where the calls are happening, obviously the majority are in the city of Reading, but we're starting to go into other towns, other townships on a more regular basis, in particularly Western Berks area, Sinking Spring, West Reading. That's becoming more and more of a frequency. When I first started in 2006, it really wasn't that much for us to go out. We're going more and more, so that means that it's longer turnaround times for us to be available to serve everybody, but it's double-edged sword. If we say, no, we're not going to do it, then other services in turn could say that to us, and it would mean a delay in care, a longer delay in care. So it's obviously something we're trying to avoid.
So I do have a question for you, Michael. As you're talking about animal bites, has that been reported? Because we haven't seen anything about that.
There's only been like 1 or 2 in the last month. I want to say that anytime there is an animal bite, that we do make sure that Reading police are made aware. That's a standard operating procedure. And they usually take care of reporting things as they're at the hospital.
Okay, thank you.
And unfortunately, last but not least, Dr. Paul McMullen, who is an emergency room physician at St. Joe's, late 50s, early 60s. He was doing the tunnels to towers, hero run, walk, stair climb, and he had a sudden cardiac arrest. So just we passed on our condolences to him.
I don't think I can understand that.
Yeah, I didn't get that last bit either. Can you repeat that?
Yes, I'm sorry. He had a sudden cardiac arrest and died while doing this event. And, we passed along our condolences to St. Joseph's Hospital in the emergency room, because he was one of the mainstays of the ER for several years.
Wait, you mean the physician has died?
Yes, I guess,
Oh,
the things they do is, it's a tunnels to towers stair climb. It's
right,
basically the distance involved, for 9/11.
okay,
And it was an
right.
event, and, I guess he got to a certain point, and he must have overexerted himself.
Oh, wow. No, yeah, I'm surprised I hadn't heard about that. Just being in the community for the physicians. Wow, okay. I have a question. I saw on the April report under transport mode, only about 10% of them were emergency, 90% were non-emergency. Does that mean they still go in an ambulance? You're just not sirening going fast, or are they getting there some other method?
Correct. Usually what that means, it doesn't necessarily indicate the severity. I guess the best way I could put it is, say you have someone with severe anaphylaxis and they're covered
Right,
head to toe and their airway is swelling. If we're
right,
getting them, they're still having an issue, we're going to transport them emergently to the hospital with lights and sirens, because obviously there might be more needed. If
right,
someone has chest pain, but the cardiogram is not showing an ST segment elevation MI, but their pain might be relieved with nitro, we can, I don't want to say downgrade, but we can take that a normal ride into the hospital, because they'll already have an IV in, the hospital have already gotten the cardiogram, and there's nothing exceptionally out of whack that needs like immediate, And plus the other thing too is, with the way a lot of people drive in the country, it's a safer mode to transport that way if need be.
yes. I imagine every time you go full scream with the ambulance fast as heck, that you have some increased risk of having some other disaster.
Unfortunately,
Yeah, and we observed up at the corner of Hamden Boulevard the other day, there was a parked school bus with the stop sign out and the four-way flashers, and two cars zoomed right by. Didn't even slow down.
Yeah.
But the driver in the bus said, "Oh, we have cameras. We get those people." So yeah, people around here, the way they drive, I agree.
Terrible.
Anything else?
no, that's it, Doctor.
Well, thank you very much. Oh, are you still testing people when you pick them up if they have appropriate for COVID?
That's more or less done at the hospital. We haven't really had to utilize the PPE equipment. Um,
Right.
But again, it is available to our people, especially when we have the cold and flu seasons. We can obviously take care of people and adequately protect our people.
Right. Okay, good. All righty, terrific. All righty. Well, thank you then very much. That I guess is the end of the EMS health literacy program. Anybody talking about that today? I'm looking here. I'm not sure who that would be.
We don't have
Perhaps
a rep with us today, but the data share breakfast event was this morning. I did attend
Okay.
that, and
Oh.
I will be asking if they can share some of that data that was shared at the breakfast, so that I can put that out to all of you so you can see the
Okay.
statistics.
Okay. All right.
And I
Very good.
do plan on, I think they're here for a few more months before the grant closes, so I will invite them to the next meeting so we can do kind of a wrap up with them.
All righty, great. Then on old business, we have the ambulance demo, but Mike kind of addressed that. Unless there's anything else to add, I don't think so. It sounded like he said it's in progress. And then new business, the Berks County Department of Health. I don't know how many of you saw this on the there was a link to like a summary. And then there was, I also went and looked at the whole report, which is actually quite lengthy. But for those of you who did not see the whole report, the summary basically, I mean, it's real quick. I'll just go over that. It's 4 bullet points. One is they want to create a Berks County Health Director position. They want to establish a public health advisory panel. They want to support the establishment of a Healthy Berks Coalition to act as a coordinating body for public health efforts in the county, and then create a Berks County Health Data Analyst position. So it seems like the county is having a lot of discussions and want to go ahead with our own Department of Health, which we never had in the past. And exactly what role we would play in that is unclear. I don't, does anybody here know anything more about this than I do? I didn't know if you might know some more, Dr. Wang.
No, I don't have any secret information on that. So I think,
Okay.
I mean, you could tell they were building that way with the commissioner's report, and they were making a good case for it at that breakfast they had, and so I think there's been talk of it even pre-pandemic, like why didn't we have a health department, that I'm sure you had heard as well, so I think.
Well, in the beginning of the pandemic, yes, I was very involved with that because we couldn't get any information in places like Bucks County. But then they explained, which I think you all know here, that we actually do have a health department, but it's run by the state and it's shared between, there's an office in Cherry Street who I think has 2 employees, and they do both Berks and Schuylkill. So clearly it's not the same thing. But my understanding is that if we would have our own department, the state would give us some funding towards it, since we don't use them, but it wouldn't be nearly enough funding to cover, what they have in mind. So I guess that's something they have to address too at a county level. Any other discussion on that? All right, other business, or is any other new business?
So that's.
Dr. John, hi, my name is Juan. I ask you a question because for my own information, it's different companies in Bell County that they take care of old people. They send the helper to take care of old lady or take care of old men. My question is, who regulated this company to the point not one of them that I know so far have a CPR training? So I know they cannot give medicine to the old people, but CPR, I believe, is necessary for these persons that they take care of old people, because a lady suffered low pressure. Her helper, she don't know how to do CPR. Thank you to God, the ambulance showed up 3 minutes later, so that's good for the ambulance. But in that 3 minutes, the lady suffered 3 strokes and she died because nobody was there to give her a little air to the lung, or. So my question is, who regulated this company to train these people in CPR? Or that is something the city can do it, the state can do it, somebody to train this person, they take care of old people, in CPR, because see, we can do it now, or any way we can find it out, who regulate it, we can save a lot of life. Because I know the person, he died is.
I'm surprised that any healthcare provider, even a lower level healthcare provider, not necessarily a nurse or a physical therapist, would be trained in the bare essentials. I mean, it doesn't take much. It takes like an hour session to be trained in the lowest level of CPR. I mean, if you want to get advanced life-saving certification or something, that's much more involved. Are these companies that you're referring to, that you're concerned about, are these government agencies that are giving this help away free, or are you talking, there are many companies you can hire people to come in and do that?
They're private company. The way I see they look, they're private company that they hire only Hispanic people to take care of the Hispanic people. In this case that I'm talking about was my mother-in-law. She died Saturday because her
Oh, I'm sorry to hear that.
She don't know how to give it CPR. We love the lady, but come on, you're there for 3 minutes, you cannot save her life. It's like really tough.
Right. Well, yeah, I mean, if you want to give us the name of the company, I mean, I guess it wouldn't be inappropriate. I could call and just say, what, do you train your staff in CPR? I have no idea whether there's any I would think there'd be some regulation. Anybody who calls himself a caregiver and comes into the home would be.
I would say.
Yeah,
You would think.
unfortunately, my condolences to you and your family. What I'm assuming this was a home health care aid covered through Medicare.
Yeah, yeah.
Okay. I'm not aware of any local regulations or oversight. Everything is done through Medicare for that. So qualifications, training, expectations. But like Dr. Dethoff said, we can look into it.
I appreciate if that happen.
Why don't you give the information, when you're offline, you can send it to Michelle or to me. And I'd be happy to make a phone call and just say, hey, we're curious. Something came up at the Board of Health about a care worker who didn't know how to do even basic CPR. You'd think they ought to know how to do CPR and a Heimlich maneuver and know how to give naloxone. I wonder if they even carry naloxone. I don't know. But we'd be happy to look into it. Seems like that would be bare minimum that you have to call yourself any sort of care worker.
Yeah.
Wow.
Thank you.
Now, I haven't been certified myself in a few years, but I would go ahead and give it regardless.
Like I said, the ambulance showed in 3 minutes, but the doctors in the hospital said that 3 minutes she stopped breathing. She had three.
Oh,
three
right.
drops, and that's why she died from.
Right.
Oh, boy.
In fact, you'd almost wonder whether people ought to have an AED in the car and know how to use it. Although they're pretty simple. All right. Well, thank you for bringing that to our attention. That's, I think, a very valid question.
Thank you.
I'll say.
Any other comment on that? All right. Well, then the next meeting, I guess, like I said, I think this Zoom thing just works so much better. We get better attendance. I mean, there's so many people sitting in offices that are away from City Hall who wouldn't be able to make it or who historically didn't make them, that they're making it now. So I'd say keep doing the same thing. August 6th does put us into prime vacation time, but let's keep it, unless somebody has an objection that they know about now, we can keep it at that. And when we get nearby, if we need to move it, we can move it.
Dr. Dethoff, I just did
okay?
have one potential other new business.
Sure. Yeah.
So Michelle mentioned that I had spoken to Bethany on Saturday. And I just have to bring this issue to the attention of the board as well. But the street sweepers are often run without their water systems, creating massive clouds of dust and air pollution. Not to mention the noise pollution, the financial impacts, the parking tickets, and different things like that. So this issue had come to my attention through a number of different complaints that I had noticed on some Facebook Reading community groups, and I actually witnessed it myself. And Bethany is aware of it. They know that this is an issue or can be an issue because over the winter, the freezing months, the machines are unable to be run with their water systems because they have to winterize them, and they're not, they don't want them freezing and different things like that. I just wanted to bring it to the board's attention because air quality, is a big problem in the inner city to begin with, but then these machines are creating concentrated dust clouds of both the automotive pollution that falls to the ground, but we know that we have issues with lead and anything else that could be in there, like animal excreta or different things. So I had talked to Bethany about it, and then councilperson Baez was interested in kind of exploring this issue a little bit more, to see if there might be some recommendations regarding the use of the street sweepers by the city moving forward.
Did you have any understanding? I understand what you gave us an explanation for why they don't use the water in the dead of winter, which is no longer. Did you ever get any explanation why they don't use it now? Is it just too timely to keep filling it?
She said sometimes it's user error. Sometimes it's it's out sometimes. So Bethany is working on it. It is an active issue that she's looking to address. Right now, I think She said that the main issue is kind of pinning down the areas that are most impacted and that need the street sweeping the most, because the street sweepers are partially funded and oversight belongs to the DEP as part of an initiative to keep those pollutants out of the river. However, the street sweepers are not designed to actually pick up trash. They're only
Right.
specifically designed to pick up the particulate matter that the DEP doesn't
Right.
want in the river. So part of it is they're looking at different routes that they want to go on, you know, where are the most polluted areas. They want to consider possibly not running them over the winter months when they can't run the water system, you know, different things like that. But I just wanted to possibly help Bethany in her endeavors by bringing it to
Sure.
this board's attention, to see if we can maybe, you know, talk to council or pass the message on to council to take it a little bit more seriously.
Sure. I'm sorry, I need, tell me again who Bethany is.
Bethany Ayers Fisher, she's the city, Michelle, what's her official title?
He's a
She's-
sustainability manager.
It's the sustainability manager.
Sustainability manager, that's what.
Oh,
I'm
okay.
sorry, I
So
didn't
she's
mean to
like,
jump in.
yeah, she's the liaison between the DEP, and she coordinates all different types
Okay.
of environmental health efforts for the city.
Oh, okay.
They
Well,
actually have
Michelle,
their
could you
own,
send-
they actually have their own board like we do, the EAC.
Yep.
And she actually mentioned possibly like having a joint session or a meet and greet or something at some point. So
Michelle, could you send her an email, just tell her that we discussed it and that the board did feel like this could be an issue of quality, you know, for respiratory issues. And if she would like to come to our next meeting, that would be great too, or just, you know, let her know that we are concerned about it and that we're interested.
Okay, will do. Also, to let
Wonderful.
you know, I am the staff liaison also to the EAC. So if there is a joint meeting
Oh,
in the
okay.
future, it'll be nice and easy to coordinate. So
that's awesome.
Great.
Thank you
Okay.
so much, Michelle.
I actually found out
Welcome.
one negative of those street sweepers. We walk almost, you know, in the winter months, we walk daily in the neighborhood. And I haven't seen this for a while, but for the longest time, we would constantly find these long metal pieces. And it was driving us nuts. Like, where do these come from? They didn't look like they were nails or any kind of construct. And what it was the metal brushes that were falling off the street sweeper.
Oh, my God.
I don't know if they caused a problem. They didn't look like they were flat. They didn't look like something you'd get in your tire, but every time we saw them, we picked them up, got them off the saws.
Oh,
Has anybody
Yeah.
ever seen those?
Well,
No.
what Bethany intimated to me was that they're kind of like a necessary evil. Like this is the solution that the state DEP has put forth to help the river pollution across the state.
Yeah.
So it's not that we don't want to run them. We just want to make sure we're creating the least negative impacts, you know,
Sure, of course.
possible.
Yes,
Yeah.
right, of course. Yeah, right. All right, well, great. Any
And-
other new business or old business or other business?
I just want to
And
make
can we
a
have
comment,
yes,
if I may. Jordan, I
Absolutely.
completely understand what you're saying, but as a person that lives in the city, I mean, I don't know how familiar everybody is. I live in a 200 block Orange Street, and without the street sweepers, it's a total disaster. I mean, the trash is horrible everywhere. So how to find the middle ground between what you're talking about and
Yeah.
what I'm seeing, I don't know the answer to that. Maybe that's a future discussion,
Well,
but
the biggest problem is like literally they're not designed to pick up trash.
I
They
understand
don't
that.
do that. So what we talked about was possibly having the city council make a motion or some type of resolution to possibly shift some of the money that's saved from not running them as often or only in specific areas into the Clean City program that's run by Ryan Bradley, where he's actually putting boots on the ground and leading community initiatives to clean up the city. You know, just not eliminating it, but like repurposing it and trying to do it in a better way.
And I would love to say that Ryan Bradley is doing an amazing job.
Great job.
He really
Amazing
is.
job.
He has a lot of followers, and
Yep.
I think, his block captains are doing a great thing.
Yeah.
But if the street sweepers aren't there, I mean, I live across from Southern Junior High, for those of you that know where it is. The
Ooh.
kids just walk down and throw chip bags all over the street all day long. On trash day, everything's just out of the trash cans and in the gutter. I mean, I don't know the answer. I'm not saying I know the answer, but it's a discussion that needs to be had.
Yeah.
And I will
All right,
say,
well,
my street is also swept every week. I live across from Pandora Park, which is also heavily used by young people, and we have a baseball field. And the people who play on the fields, adults playing ball games, are no more responsible with their litter than the kids that are playing in the park. So it's a bother for us to do the alternate side parking every week, but it really does help get, and I know it's not for litter, and some of us pick all that up on trash day and throw it in our buckets, but it does help keep a lot of the small stuff off the streets.
one thing I thought was terrific, I don't know if they've done, about a couple of weeks ago, we had dumpster day where they put dumpsters all over the city. And I availed myself of that opportunity to clean out my garage. Was that the first time they ever did this? Is that a yearly thing or?
That's
They-
annual, it's every spring, and I think it just happened a few weeks ago.
It did, yes, yeah. And do they just do it once a year?
It is once a year for like a spring clean out, when everyone's doing their
Okay.
spring cleaning.
It coincided with when the people in our area were all invited to do their yard sales on that one day. I didn't know whether that was coincidental or, but I
Yeah,
thought that was a terrific thing. And I could see that, I don't know how much it cost the city, but it'd be good to do that more than once a year.
Too bad it rained.
Yeah, I was up at like 8 o'clock. All right. But yeah, I thought that was terrific. I thought, you give people a chance to throw big stuff away. Because I called the city, I had some big stuff to get rid of, and they said I could take it up to the transfer station, but the minimum charge is $70. Now you get like, I don't know, 1,000 pounds for that, but I didn't have 1,000 pounds. But maybe that would decrease the number of, sofas being dumped on Skyline Drive.
The trucks that sweep the streets, they don't pick up the trash. Are
no,
there any pieces of equipment similar to the vacuum trucks that pick up the leaves that would suck up the trash, which is basically paper, cardboard?
Yeah. I don't know. I think that's just why I brought it to the attention of the board, just to explore what options are available. Just see if and when something can be done. I don't know. You know what I mean? It's just something that,
Sure.
Came up, and I just wanted to bring it to everybody,
I mean, my understanding is the trucks are not designed to pick up trash.
Yeah.
I do realize that they're designed to pick, maybe a cigarette butt or something like that. But as I have said, I think it needs to be a conversation that is
Yeah.
had.
All righty. Well, they can discuss that at that committee that does the clean street stuff and see where we go from there. All right, terrific. Any other thing for the good of the order? Well, then, unless we hear otherwise, we'll convene again on August 6th. And can I have a motion for adjournment?
I'll make that motion.
All right, and a
Second.
second. All right. Well, we'll see you all in 2 months. Have a nice summer. Everybody stay safe.
You too.
Bye-bye.
Have a good one, everyone. Thank you.